Hi, I'm Edward Schuster. This is your tip of the week. So I'm wearing jogging clothes because today I had a stress test. Doctors have to take care of themselves also. Now, why get a stress test? Your heart is like buying a car. You can look at it, but you really want to take it for a drive. So your doctor can talk to you, listen to your heart, and do an EKG, but that's not good enough. You got to get on a treadmill and let somebody really see how your heart works during stress. So if you're over 40 or 50, if you're a smoker, have high blood pressure, diabetes, high cholesterol, or especially have heart disease in the family, get a stress test. So today's tip of the week is teaching hospitals what they are and some information that could save your life. Teaching hospitals are hospitals with medical students and residents. The attending doctors teach these people how to become better doctors as they grow up. So there's advantages and disadvantages. One disadvantage is sometimes patients think they're being experimented on, but the advantage is when you have to teach people, maybe you're smarter and maybe you pay more attention. Some insurance networks have excluded teaching hospitals because they think they might be too expensive. Now, I work at Stamford Hospital in Connecticut. We're a teaching hospital. We have Columbia medical students, and we have interns and residents in many fields. So we're a teaching hospital, and I'm proud that in my years here, I've won Teacher of the Year award 5 times. So I think teaching is good. There's been a recent gigantic article in JAMA, the Journal of American Medical Association, that looked at 21 million hospitalizations for Medicare patients at over 4,000 hospitals. And what they found out is if you're at a teaching hospital, your death rate is half of that if you're at a small or a large community hospital that does not do teaching. So a teaching hospital is good for you. Your death rate is half of a non-teaching hospital. However, if you're in a teaching hospital, be careful. There's what's called the handoff, the transition time, where the residents and the hospitalists who are taking care of you leave and a new team comes. There was a scary study from the VA that during these few hours of transition, the death rate doubles. So that's your danger zone, when the doctor who's been taking care of you leaves and a new doctor comes on. So what can you do? When you meet the new doctor, if you're awake and alert, tell him who you are. I'm here for my gallbladder attack. I'm allergic to penicillin. Give him some information to try to help him. If you're with somebody who's in the hospital and can't do that, try to be there during transition time. Now, when I was an intern and resident at Duke, there was no such thing as transition time because we worked all the time, all day, all night. There were 2 of us on the floor. I worked 5 nights and 7 days. The other person worked 5 nights and 7 days, and there was never a time when there was a doctor there who did not know the patients. But those days are over. Since the Libby Zion case, there was a case in New York where a patient died, and it was thought that the residents were just too tired, so they cut back the hours that the residents could work. I've often thought that was wrong. At Duke, there was a sign over the door, if you can't get your work done in 24 hours, you're going to have to stay up late. We would never leave a sick patient. We would never have a change of shift. We would always stay until the patient was okay. So finally, after 15 years, the people who make the rules have also changed their mind, and now they're allowing young doctors to work 24 straight hours and even stay an extra hour or 2 if it's important for the patient and the family. About time.